One of the common problems we encounter in our daily practice is postpartum women after childbirth coming with back pains. Let's try to understand why do these back pains happen after a pregnancy. If we talk about a normal pregnancy, it's basically a woman's body preparing to deliver a baby, and in this preparation it undergo a lot of changes. One of the important changes is release of a hormone called as relaxin hormone. So what does this hormone do? It basically loosens up all the ligaments, tendons and the soft tissues in the body. Now basically the body is preparing to relax the pelvis so that a big baby can be delivered easily through a small space. Now this relaxation of the ligaments and the tissues leading to joint looseness also loosens the back joints, the joints which are there in our spine, which leads to increased stress on the joints and subsequently more chances of developing a back pain. Apart from that, the sheer weight which a mother gains during the process of pregnancy puts in extra load over the back, over the spine, which can itself lead to back pain. That most of the weight which is gained in the abdominal area is actually eccentric. By that I mean the weight is almost all in the front, very less weight gain on the back. So that kind of shifts the center of gravity more in a more forward position, and hence to balance the body, the woman has to bend backwards so that she can walk. Now this leads to abnormal posturing of the lower back, which can increase the incidence of back pain. Apart from that, a growing baby needs to develop bones and muscles for which it is totally dependent on the nutrition from his or her mother. So that leads to draining of lot of calcium, vitamins, minerals and lot of other proteins from the mother's body, which are used to make the organs, especially bones, muscles for the embryo, and that leads to significantly high demand for these nutrients for the mother. If not met properly, these can also lead to weaknesses and hence the incidence of joint pains, especially back pain. Once the baby is delivered, then odd posturing while trying to feed the baby, they sleep on one side so as to protect the babies, that inadvertently they should not sleep onto the baby or the baby might get injured. So those things can also lead to bad posturing and also to back pain.